For interns to obtain the greatest benefit from their engagement in a patient case, debriefing after the event is important. Case-based discussions are retrospective explorations of clinical cases by interns and supervisors. This video illustrates how to conduct case-based discussions and assess intern performance using the case-based discussion tools developed by the Australian Pharmacy Council. The first example is a case-based discussion following the management of a patient with early warning signs of mental illness.
So I saw you just had a patient consultation. Did you want to have a case-based discussion about it?
Yeah, so the conversation itself went well, but I did have a few questions I'd like to clarify with you.
Yep.
So the patient's name was Brad. He was a 37-year-old male and he came in requesting valerian. So he was wanting it to treat symptoms of worry and anxiety that he's been experiencing for the best part of 6 months. So he hasn't tried anything before, nor has he seen anyone about the current issue. So he's experiencing symptoms of feeling on edge. He's quite tired and he's finding disruptions in his sleep. So the persistent symptoms described by the patient could indicate something like an anxiety disorder, which has yet to be diagnosed. So I referred him to seek further medical advice from his regular medical practitioner on the issue.
Here, the intern has chosen to structure the case using ISBAR: identify, situation, background, assessment, recommendation. This is an example of a simple and effective approach to case presentation.
Did you look for any evidence behind the valerian or complementary medicines?
So I used the APF, so the Australian Pharmaceutical Formulary and Handbook, and the information on valerian suggested that it's not well recommended and there is not sufficient evidence for its use, and it may not be appropriate for this patient.
Okay, so it's very important for us to be confident in our recommendation, and using one source is not enough. To provide an evidence-based advice, we need to rely on a variety of resources to support our claim. So it's good that you referred the patient. What's an appropriate time frame for us to let the patient know to get to the GP?
So I wasn't particularly sure for this scenario. However, because this patient has had symptoms for approximately 6 months, I'd say within the next week or so would be best.
Okay, so it's really important that he understands that it's quite urgent for him to go see the GP. So I think that's an area that we can improve, communicating that key message. Did you consider any other non-drug strategies that we can help him with?
I considered a few different options. However, I decided they may mask the symptoms and delay a proper diagnosis for the patient.
Okay, so I think the referral was great. There were some missed opportunities. For example, to optimize the patient outcome, we could have recommended some sleep hygiene, relaxation strategies, and some psychosocial interventions.
A convenient way to structure feedback for the intern and promote future learning is to use the keep, stop, start approach.
So I think your consultation went well. I wrote down 3 points to go through with you. So keep considering those red flags and criteria for referral. That was good. Avoid using just the one resource. It's important for us to consider other evidence-based resources as well. And start considering those non-drug therapy options such as relaxation, sleep hygiene, and those psychosocial interventions just to optimize the patient's outcomes.
Yeah, that sounds good.
So based on the chat we just had, I think you're progressing well. There's just a few areas for us to work on. We now know where to focus, such as broadening your non-drug recommendation options and improving your communication just so that we're sending those key messages to the patient. So I think you're doing really great, Caitlin. I'm just going to complete your form and we'll just keep these discussions going on.
Yeah, sounds like a plan.
With a little preparation, a case-based discussion is a simple conversation.
I feel like I got out of this a deeper level of learning than if I just completed the patient interaction alone. And after this, I now know what I'm doing well and where I need to improve in the future.
I find it usually difficult to assess my interns' clinical judgment and decision making. So it's useful to have these case-based discussions to see how they arrive at their decisions, and in this case, the referral to the GP. So the case-based discussions really help me in seeing their thought process and the thought component in the case.
Now let's look at the following example of a case-based discussion, following management of a patient with oral thrush.
So I saw Elaine, she's a 68-year-old female, during this morning's pulmonary rehab clinic. Elaine presented with some concerns about her inhaler and some oral symptoms. Elaine has only recently been diagnosed with asthma, and she also has a history of allergies and dermatitis. On reviewing Elaine's inhaler technique, I noticed that she really isn't able to coordinate release of the medication and her inhalation. And she's also not rinsing her mouth after her dose. The persistent symptoms that Elaine describes sound most likely like they're due to oral thrush. So I've recommended a spacer and Nilstat oral drops for the treatment, and also rinsing following use of the inhaler.
So that was a good case. Shall we discuss it?
Sure.
Yep. So in what circumstances should we refer a patient to the GP for oral thrush?
Well, if there are systemic symptoms, so if the patient feels generally unwell, if the symptoms last longer than about 14 days, and if they were pregnant or breastfeeding.
So how long should we recommend the patient to take Nilstat for their oral thrush?
Or until the symptoms resolve. And maybe for about 48 hours after the symptoms have resolved.
So I see you're not quite 100% sure about that.
I'm kind of guessing.
Yep. So it's important for us to provide information on follow-up and specific details about the medication. Is there any other medical conditions that you can think of that might increase their risk of oral thrush?
Oh, maybe diabetes?
So I think you're on the right track. We just need to focus more on improving your understanding of all these medical conditions, especially with how they might increase the risk of oral thrush. You were definitely right that poor inhaler technique could have contributed to the oral thrush.
Your feedback doesn't need to be an essay. After all, it's a workplace-based assessment. Again, a convenient way for the preceptor to structure feedback and promote learning is to use the keep, stop, start approach. It's as simple as that.
So that was a good case. I think our discussion went well. I wrote down a few notes here to share with you. So firstly, keep taking a thorough patient history and considering non-drug solutions that can assist our patient, such as improving inhaler use. Avoid providing general information about medicines, but focus on their specific instructions, such as duration. Start considering comorbidities, such as poorly controlled diabetes, that may be the cause of presenting symptoms. So based on our chat, I think you're progressing well, but there's just some areas to improve, but we know now which areas to focus on. So such as, how other medical conditions play a role in increasing the risk of oral thrush, and some counselling points relevant to the individual patient.
Thank you so much. That's really helpful.
No worries.
I like the flexibility of being able to choose your own case for the case-based discussion. I also appreciated the process of having to present. My supervisor asked me questions about the case that further challenged me and which I'd never thought of.
So case-based discussions are easy to do with my interns. They're nice, quick and easy. Don't have to make them too complicated. Just a conversation discussing the case. Having a case-based discussion enables me to go through and explore the thinking process of my intern. And only through our discussion am I able to determine if she's considered diabetes as a possible issue contributing to the patient.
In this way, case-based discussions are a simple but powerful way to accelerate trainee development and give preceptors opportunity to guide intern performance. For more information on case-based discussions, visit the APC website at pharmacycouncil.org.au.